Diabetes. Odds are you don't have it. So why should you care? Because the percentages show that if it doesn't affect you directly, it likely affects someone that's close to you, and the complications of the disease are very serious. As you see, there are three numbers on the slide behind me. The first number is the United States population according to the 2012 census. The second is an estimate of the amount of people in the United States who have type 2 diabetes. And the third is an estimate of the amount of Americans who have prediabetes. To put this on more familiar terms, there are 8 people in the room. These numbers indicate going on that 93.3 million people are diabetic or pre-diabetic, and it makes up about 30% of the population. About 2 to 3 people in this room, according to the numbers, are diabetic or pre-diabetic. To put that in even closer terms to you, if you have 4 people in your family, let's say you have 1 sibling and 2 living parents, the numbers indicate that at least one of you are diabetic or pre-diabetic. Diabetes is a disease of excess sugar in your blood, and when you don't control it for years, over time, it leads to what I call the diabetes benefits package. When you get a good job, you get a benefits package. Paid time off, sick days, health insurance, all good stuff. But when you get diabetes, you get a bunch of benefits that are terrible. Loss of vision. This is known as diabetic retinopathy. It's the leading cause of blindness between people 20 to 64 years old. Loss of sensation in your hands and feet. This is known as neuropathy. This comes from nerve damage and clogged arteries that results from out of control blood sugar. Often people who get neuropathy end up getting their limbs amputated. Toes, feet, lower limbs. Kidney disease. 44% of people who are on dialysis for kidney disease are diabetic. 75% of diabetics die from heart disease. And finally, depending on the study or the textbook that you look at, diabetes shortens your lifespan by 4 to 10 years. Hopefully I have your attention by now. It begs the question, if your blood sugar is starting to rise, is diabetes an unavoidable death sentence? Are you tied to the tracks when the diabetes train is coming through? Or do you have the power to walk off the tracks? Thankfully, there's an answer. Researchers put together a study of 3.2 years called the Diabetes Prevention Program. They took over 3,000 men and women who are pre-diabetic and assigned them to one of 3 programs. The first one is the lifestyle program. Essentially, they followed simple diet and exercise tips. They were told to exercise, perform moderate physical activity for 150 minutes a week. Diet speaking, they were told to eat less fat, eat fewer calories, and eat more fiber. The second group took a medication, a popular diabetes medication known as metformin. And the third group was the classic control group. They stayed the course, kept living like they usually do. Here are the results. I'll try to explain this in as simple terms as possible. As you see, the researchers broke down each group into age categories and then said per 100 years lived during the study, how many times were people diagnosed with diabetes. Now obviously the study was 3.2 years, so they took every person in each group, in each age category, and combined them to get 100 total years, excuse me. As you see with younger people, whether it was medicine or lifestyle changes, either seemed to work. But as you get into middle age and 60 plus years, you find that lifestyle poses a huge advantage over medications for preventing diabetes. To put this in more simple terms, the medicine group reduced the risk of getting diabetes by 31% compared to the group that did nothing. However, the lifestyle group reduced their risk of getting diabetes by 58%. I think those results are pretty damn good. But they don't tell the full story. The lifestyle group was pretty poor at adhering to the exercise program. Less than 2/3 of the lifestyle group actually reached the recommendation of 150 minutes of exercise per week. And this is just basic exercise, moderate physical activity. So this is gardening, walking, riding a bike, things that most people can do. In addition to that, the lifestyle group followed recommendations that research shows is not the best way to eat and exercise to control your blood sugar. There are much more effective ways to go about controlling your blood sugar through your actions, especially when it comes to eating and exercising. In closing all of this, there are a few things I want to point out. You saw the slide with the diabetes benefits package. Those are some terrible long-term complications. But those usually happen to people who are diabetic for many years. You can control your blood sugar, as you see, through your lifestyle. There's popular advice that is, your fate is in your hands. And I agree, but I would take that one step further. Your fate is in your lifestyle. If your blood sugar rises, you have three choices. You can be the control group and stay the course, continue living as you are living. You can be the medicine group. Take a medication, keep your lifestyle the same, deal with the side effects of the medication, but also get some benefit. Or you can be the lifestyle group. The choice is yours. Thank you.